Magandang hapon po sa ating lahat. Magandang hapon mga classmate. Magandang hapon po, Doc. Ngayon po ay ituloy natin yung ating topic sa foundation ng yin and yang. Yin and yang relationships. So, napaganda ng drawing. Yin and yang relationship. So, this is a picture of yin and yang in absolute balance in every organ. So, pag balance po yung organs natin, ganyan ang itsura, balance yung yin and yang. Every cells of the body. Pero this almost never occurs except during a transitory stage. Yin and yang are all ever changing their state, always relating to each other, thus changing the state of the organs in the body as well. So kaya lang po hindi talaga laging ganyan nangyayari yung balanse ng ating katawan. Mamaya po makikita natin bakit. Pero hindi ibig sabihin may sakit ka. Yan. Yin and yang balance. Kasi sinasabi natin na hindi laging may sakit ka kahit hindi balance. Tulad po nito. Sa umaga, pagkagising mo, syempre, kakain ka, good breakfast, tapos yung energy mo ay magiging ganun po balanse. Kasi pagkagising mo, maganda yung tulog mo, then kakain ka, so balanse. Pero pag gumalaw ka na, ito na pang nangyayari. But then we start to work or to be active and our yang increases to create functional energy. So pag gumalaw na tayo, magagamit na natin yung energy, kaya unti-unti nang bababa yung yin. The blood and yin decrease as they give up the stored nutrients to fuel the functional energy. So habang gumagalaw ka po, nagagamit na yung syempre yung blood. Yun ang nagiging lakas natin eh. Bumababa na siya. Parang yung motorsiklo, di ba? Pag in-start mong gamitin, gagamitin na yung gasolina kaya kumukonti. Parang ganun din po yung katawan. Tapos at the end of 4 hours of work, our yin, yung blood, decrease according to use and we feel tired, hungry, and thirsty. O kaya paghapon na, di ba? Or minsan, bandang tanghali, yung mga nanay na maraming ginagawa, nakakaramdam na ng pagod. Tapos, kailangan minsan magpahinga, tapos kakain. Yun, lalakas na naman uli. So, after eating, siya na po yun yung ating diagram Yung, after eating a big lunch and dessert, we are too full of food. Yung food natin yin. To go on being active and feel lethargic, sleep, and lazy. So pagkakain natin, busog. Kaya ganun po yung state natin. So dahil busog tayong yin tumaas, nakakaramdam tayo ng gusto nating matulog. Parang mabigat yung katawan natin kasi nga tumaas yung yin. So ganun pa ang nangyayari. Pero hindi naman ibig sabihin nun may sakit ka. Dahil kumain ka lang ng marami, kaya ganun mararamdaman. So, a disease is an imbalance between the yin and the yang. So, pag hindi, ang sakit po, pag nasa organ na natin, makikita natin pag hindi na balanse yung yin and yang, yung init at lamig ng ating katawan. The normal imbalances in everyday living, halimbawa, hunger, tiredness, fullness after eating, excitement, are quickly balanced by eating. So, pag gumagalaw ka, tapos nakaramdam ka ng gutom, pag kumain ka, magbabalance uli yung yin and yang mo. Halimbawa, yung yin ang bumaba, pag kumain ka, tataas uli, babalanse. Resting or exercising, or pag nagpahinga ka, pag nag-exercise ka, yung bumabang yin or yung yang, tataas uli yun, magbabalance sila dun sa normal level. But imbalance of disease do not get corrected that easily. Pero kung may sakit po, hindi yung pag nagpahinga ka ay nawawala. They are more prolonged and need to be corrected with treatment, diet, and change in lifestyle. So yung pag may sakit na po yung organ natin, kahit kumain ka, kahit nagpahinga ka, hindi po siya agad nawawala yung nararamdaman. So kailangan na po yung gamutin. Tingnan na natin yung mga diet natin, tapos yung lifestyle na inuulit-ulit natin. Halimbawa, sumasakit yung ulo mo kasi tumataas parang presyon mo. So, tapos kakain ka pa rin ng matataba at lagi ka pa rin nagagalit. So, lalo pong lalala. Kaya dapat po tinitingnan na natin yon. For example, a patient with hyperthyroidism. Function is often hungry, hot, sweaty, and tired. Yung hyperthyroidism po, pag i-ano po natin sa traditional Chinese medicine, pag i-diagnose natin, parang mas more on heat to damp heat in the spleen, stomach. Kasi yung mga ano po nito, yung mga sign and symptom, makikita natin na, halimbawa yung nagkakaroon din po ng rapid heartbeat, tapos yun, gusto niyang kumain ng kumain, yun, feel niya hungry, kahit kumain pa lang siya, gusto na naman niyang kumain. But this not improve with eating or rest. So kahit magpahinga, kahit kumain, hindi po nawala. This imbalance is that of a disease. So yun pa ay sakit. Therefore, treatment of the disease would be to balance the energy. So kailangan pong i-balance yung enerhiya. Halimbawa yung spleen, tumaas po yung init, kaya nakakaramdam siya ng laging parang gutom, tapos mabilis yung heartbeat niya. Pag tiningnan po ang tang nito, tiyak yellowish yung kulay. Sa gitna, thick yung coating. This can be performed by acupuncture, diet, and herbal medicine taken internally, exercise, relaxation, and change in lifestyle. So pag ano na po yung organ na yung involved, dapat na po talaga i-acupuncture. Tapos sa diet po, kung alam mo halimbawa yung explanation po natin na hyperthyroidism, maraming damp yung kanyang spleen, stomach, pero kumakain pa rin ng maraming damp pa rin, maraming taba, laging prito. So, hindi po makaka-recover yung organ kahit i-acupuncture. Kaya dapat po sa diet, kasabay po yan. At yung mga pwede nating inumin na herbal medicine, pwede rin po yun na ano. Mahalaga din po yung exercise kasi kahit in-acupuncture ka, nagda-diet ka, pero hindi ka pa rin gumagalaw, mag-i-stagnate pa rin po yung energy. Yun nga po yung sinasabi na pag sa mga practitioner, yung mga nanggagamot sa traditional Chinese medicine, 50% po yung sa amin at sa pasyente ay 50% para gumaling. So, kung natusukan ng tama ng practitioner yung points para lumakas, pero hindi nakikipag-cooperate yung pasyente, halimbawa nag-patient advice tayo na wag siyang uminom ng alak kasi may heat nga yung kanyang spleen, stomach, pero tuloy pa rin siya sa pag-inom, ay kahit po i-acupuncture mo yan, gagaling habang nandun sa'yo kasi tinanggal mo yung mga excess condition niya or deficient. Pero pag uwi niya sa kanila, iinom pa rin ng alak, magdadagdag uli siya ng heat, mararamdaman uli niya yung nararamdaman niyang sakit. So napakahalaga po yun yung pakikiisa ng pasyente. Tapos yun nga, kailangan ng exercise, relaxation, and change in lifestyle. So marunong kang hindi puro trabaho, trabaho, tapos kailangan po may panahon din na sa katawan mo na nagre-re-energize. Kaya nga minsan maganda po yung may family time ka, nagtatawanan kayo ng pamilya ninyo, 'yun. Kasama po 'yun sa buong balanse, pagbabalanse ng enerhiya sa katawan. So, therefore, in Chinese medicine, the diagnosis of a disease means to find the imbalance in the relevant organs or in the body. So napakahalaga po nun sa TCM po, kailangan natin tingnan ano ang imbalance na organ para yun po yung binabalanse natin. Nasaan ba yung mataas ang init, nasaan ba yung mataas ang lamig, yung yin and yang niya. So the treatment therefore is balancing of this state back to normal. So pag nakita po natin yon, naglalagay tayo ng mga points na para bumalik sa normal yung yin and yang, yung balanse ng init at lamig. Ang halimbawa po diyan, halimbawa, matindi yung pag-ihi niya, nahirapan siya, makikita mo dun sa tongue coating niya yellowish, yung pala yung yin niya ay masyado pong mababa. So mas maraming init, kidney deficiency. So pag inano mo po yung kanyang tongue coating, makikita mo po dilaw dun sa dulo. So ang gagawin po natin, tutusukan po natin siya para mawala yung masyadong init. So ganun po, ibabalanse mo. Titingnan mo kung saan yung problema, ibabalanse para mag-normal. So 18 balance state in yin and yang principle of energy balance. Ito po yung una, acute states. So mula unang araw hanggang 30 days, acute pa lang po ito, parang isang buwan Pag pumunta sa inyong pasyente at yun ang nasa loob siya ng 1 to 30 days, acute pa lang. So, posible po yan excess ang kondisyon, tulad po yan o yang. Yung yang, yung parang yung orange na kulay, mataas. So, lumampas dun sa level. Ganon din po, yung yin, pwede ring tumaas, lampas sa level. Or, pareho po siya na excess of energy. So, ang pamamaraan po ng paggagamot natin or yung technique sa karayom ay sedation o tatanggalin mo yung heat. May technique po doon paano magtanggal ng heat. Pwede rin po tayong gumamit ng points. Halimbawa, yung fire points, kung mataas masyado yung yang, gagamit ka po ng fire points para i-sedate mo po yung bawasin, tanggalin mo yung init. Yun. Halimbawa po sa ang fire points po ng lungs is lung 10. Masyadong mainit yung kanyang baga. Ang plema niya madilaw, po yung pulse niya, madilaw yung kanyang coating, thick coating. Yon. So, gagamit ka po ng spleen 10, ay lung 10. Fire points po yan. I-sedate po. Yon ang technique sedation. So, pag chronic states po, 6 months or over. So, kung pupunta sa inyong pasyente at more than 6 months na, ganyan na po ang itsura ng yin and yang ng katawan niya. So, from the balance, pwedeng yung yin napakababa na or yung yang napakababa na rin. Pero nasa balance yung niya. Halimbawa yung yin, nasa balance yung yang, pero yung yin mababa. Yung dito po naman sa isang illustration, yung yang nasa balance, pero yung yin nasa mababa. Ay, baliktad. Tama, yung yang niya mababa, yung yin niya ang mataas. So, deficiency of energy needs to be tonified. Ito naman pong pangatlong illustration, paglampas na po wala sa balance, kailangan mo pong palakasin. I-tonify mo both yin and yang niya. So, ang magandang points po pag ginagamit nagto-tonify, hanap po tayo yung earth point kasi magaling po siyang mag-tonify. Ano pang example ng earth point natin? Stomach 36, nagto-tonify po ng spleen, stomach. Po. Pag subacute naman po, so 1 to 6 months or recurrent stage. Yun. Pag hyperactive or hypersensitive yang, yung makikita natin, subacute na more than 6 months, 1 to 6 months na kaya bumabaw na po yung yin, wala na sa level, yung yang, pwedeng lumampas sa level. Kino-consume na po niya yung yin. So, pag may stagnation naman po, retention of yin, tataas po yung yin, mababa yung yang, below the level ng normal. So, pag ganyan po, nararamdaman po natin dyan syempre, pag sa hyperactive, pag tinignan po natin yung tangyan, tiyak. Thick yellow coating. Yun, mahalaga po yun. Pag pinulsuhan po natin yan, fast pulse po yan. Kasi mataas yung init. Yun. Sa stagnation naman po, makikita natin, slow po ang pulse nito. Tiyak pag tinignan mo ang tongue coating nito, thick white po. Pag excess and deficiency, to be sedated and tonified. So pag excess po, sedate natin. Tanggalin, bawasan. Alisin mo para mag-normal. Pag tonify naman, palakasin mo. Palakasin mo yung kulang para pumunta dun sa normal level. So yun po yung ibig sabihin ng ating mga drawing. Yun po yung principle pag tayo nag-acupuncture. Energy imbalances result in disease. So pag hindi po balance yung yin and yang, na line ng energy natin, magkakaroon ng sakit. This is state classified into acute. O parang sinamarize na po ito pwedeng acute yung bago pa lang, chronic yung matagal na, subacute or recurrent. Yung nakita po natin kanina, 0 to 6 subacute. Yung pabalik-balik. Example, pain with yang dominant nature. Example dito ay sharp, severe, pulsating, radiating pain worse during activity or due to the other yang causes. Yun. So, pag mataas po yung yang, ang nararamdaman niyan, sharp and severe. So, lalo yung lumalala yan pag gumagalaw siya. Lalo pong mas masakit kung may masakit siya. Means that imbalance causing the pain is yang dominant state. Yon. There are 3 yang dominant states. Yang excess. Parang kanina din po mula dun sa balanse, mas mataas yung yang. Yan. Excess condition. Kaya Pag pinulsahan mo pa po yan, malakas po ang pulso niyan, mararamdaman natin malakas yung pulso. Pag yung deficiency and yung excess, so ito naman po, yung yin niya ay mababa kasi ano na-consume na eh. Na-consume na po nasa ano na siya, subacute recurrent. Pag ito naman pong yung deficiency, mas bumaba na from the normal, pwede na po ito yung mga matatagal na sakit, yun na mga chronic na. Hindi na makataas sa yung yin dun sa normal, bawas na. Okay. How do we decide which of these three yung dominant state of our patient is in? So mahalaga pong malaman natin dun napakahalaga no acute ba to, chronic ba to, or yung isa po, yung ano natin na sub. Ask patient three basic questions. Una, tatanungin natin, saan banda yung sakit? So, answer would point the meridian or organ we should be treating or balancing. Pag tinuro kasi niya, pwede pong yung meridian mismo ng organ, andun yung problema. Halimbawa, ituturo niya sa may parteng, sa may parte dito sa may tuhod. Ano ba yung dumadaan sa may ating tuhod? Pwede yung spleen, stomach, andyan po liver, yan. So, ipapaturo natin nasaan banda. Doon pa lang malalaman natin anong meridian yung dumadaan doon. Okay po? Number 2, describe your pain. So, itatanong natin, how is the pain? Yan. Paano ba yung sakit? Pwedeng stabbing pain ba to? Kasi pag stabbing pain, pwedeng excess condition po yun Tapos, when do you have pain? Tatanong din natin, kailan po ito mas masakit? Sa umaga ba o sa gabi? So, alam natin kung gabi, yung deficient. Pag umaga, mas yang. Mas yang po So, itatanong din po natin, worsen with what? Halimbawa, aggravated by pressure. Pag diniinan po ba, mas masakit? So, sign po yun na may excess condition. Pero pag, or tatanungin natin, aggravated by cold ba yan? Pag malamig po ba masakit? Or pag mainit? Or pag mahangin? So, malalaman natin pag sinabi, ay, masakit po pag taglamig. So, alam natin na due to cold. So, itatanong din po natin, improve with what? Ano po ang nakakaalis dun sa sakit sa kirot? Ay, pag tinapalan ko po ng mainit, nawawala. So, alam natin na lamig kasi pag tinapalan nyo ng mainit, nawawala. Pag mainit po, lalong sumasakit po, alam natin na init. So, mahalaga po yun. Then, this give idea if this was yin or yang dominant. So, malalaman natin kung yin ba yung kulang sa kanya or yang, batay dun sa pag-a-answer niya sa atin. Then, number 3, how long have you been having this pain? Yung para malaman natin, acute ba to? Chronic ba to? Or subacute ba to? Or recurrent disease? Malalaman din natin kung excess or deficient. Kasi karaniwan sa acute ay excess. Pag chronic, ano na pang nangyari dun kanina sa atin? Sige po, sinong nakaalala pag chronic na? Ano po ang nagiging ng balance ng yin and yang? Pag chronic na, yung pulse na nagwi-weak na yan eh. Hindi na malakas kasi nababawasan na. So doon po natin makikita. Tapos titingnan mo yung tongue coating niya. Pag chronic, ano pa ang nangyayari pag chronic? Pwede rin thick or thin. Basta tandaan po natin pag acute karaniwan ay excess condition. Kasi nagsisimula pa lang eh. Pag lumalala na, magdi-deficient na po yun. Okay. Once we have made this diagnosis, we could balance organ or meridian. So, pag nalaman na po natin yon, alam na natin ang ating gagawin. Isisedate natin or i-reduce yung yang para bumaba at pumunta dun sa balance. Kasi pag napababa natin, napapunta natin sa balance, pwedeng matanggal yung sakit. Pero nga, sinasabi natin, dapat nakikipag-cooperate ang pasyente. Kasi kung hindi sumunod sa patient advice natin, habang nando sa clinic mo, magaling siya. Pag uwi at ginawa na naman yung dating binabawal mo sa kanya, bawal pong uminom ng alak kasi mainit ang bituka nyo. Pagdating uminom, check another day, babalik sa'yo. Yun. Tonifying, increasing. So pag ito tonify natin, halimbawa yung yin ang mababa, yung kuha ka ng points na magto-tonify. Yung example ko po kanina, yung mga earth points ay magaling mag-tonify. Pwede natin gamitin. Yin and sedating yang in the second imbalance. So kung yung yin ay kailangan i-tonify, pag nakita mo yun yung sanhi ng unang ano niya, parang yung sa chip complaint niya, i-tonify mo. Then i-sedate mo yung sobra para mag-balance. Tonify yin only in the third case. So kung ang sabi dito, kung ang sanhi ng sakit ay sobra, excess, tanggalin mo muna yung excess. Pag natanggal mo na yung excess, i-tonify mo para magbabalance na sila. Tataas na rin yung yin na kung kulang. Kailangan po magaling yung imagination natin. As all diseases of yang nature are caused by imbalance in energy. So yung mga sakit po na sayang yung all diseases of yang, imbalance of energy. Kasi di ba yung energy is yang. Where yang is dominant to yin, this not automatically mean that yang is in excess or that yin is less than normal energy level. Whether there is excess or deficient compared with normal level has to be decided by the fact if it is acute or chronic. So doon tayo magdi-decide. Ano po, makikita natin. Kung acute, magtanggal ka muna ng excess. Pag chronic, i-tonify mo dahil kailangan ka na mag-tonify para lumakas at pumunta siya sa balanse. So, yun po yung ating next is, if disease state is new, this is considered to be excess state. Parang inulit lang po pag bago pa lang ang sakit, excess. Called acute states from now on. There is excess of yang in a yang disease. Excess of yin in a yin disease. So, ayun po, makikita natin pag yang excess, mas maraming init tayong makikitang sign and symptoms sa pasyente. So, yung pag yang excess, tiyak ang pulse nito ay rapid. Ang tongue coating, pag tiningnan mo ay thick at yellow moss. Yung paano, yung coating niya. Siyempre, pupwesto po yun kung saang organ yung may problem. Halimbawa, ito sa yang excess ay kidney ay may problema. O, makikita natin doon sa dulo ng dila, thick yellow coating. Pag pinulsuhan mo siya sa kanyang chungguan chi, sa chi, pas po yan. Pag yin excess naman, so mas marami yung mas marami yung lamig. Strong po ang pulse nito, na slow. Yan, halimbawa, may lamig siya sa kidney. Pag pinulsuhan mo yung cheek niya, slow po yung pulse. Pag tiningnan mo yung tongue coating niya, thick white coating. Kasi excess thick. Yun po yung mga keyword natin Pag yin and yang excess, ayan, pareho mong mararamdaman na mataas yung cold niya. Siyempre yung pulse nito talagang malakas. Wala sa balanse Yan. Pag ganito po pwedeng exterior pa ito Naglalaban pa yung lamig at init. A disease state which has been going on or gradually worsening for 6 months is chronic state. Pag hindi po napapagamot ang sakit na hinahayaan, so magiging chronic po siya. Sinasabi din natin sa pasyente pag chronic, hindi po isang puntahan nyo, gagaling kayo. Kasi minsan, yun din yung pag sa ay pumunta ako, nagpa-acupuncture, pero hindi ako gumaling. Kasi hindi naman po talaga isahan yun, lalo pag chronic na Nagtatanggal ka ng hindi balanse. Yun. Ibabalance mo yun. Tapos dapat nakikiisa yung pasyente na kung anong patient advice susundin nila. Where considerable amount of energy has been consumed. Marami nang na-unbalance kaya po Therefore, a deficiency state, yung deficiency in yang disease, yang dominant to yin. So, mas mataas yung init kaysa sa lamig. Yang deficiency in yin disease, yin dominant to yang. So, mas mataas yung lamig kaysa kay init. Ang makikita natin pag di ba, ulitin natin, pag chronic na, from the normal level, bumababa. Yan. Kung yung yin deficiency bumaba, mas mababa. Yang deficiency, mas mababa yung init. Ito, deficiency of both yin and yang would produce both yin and yang symptoms. Pain worsening with rest and activity. Asthma during hot and cold weather. Yan po yung example ng yin and yang deficiency. Yung nag-asthma kahit mainit o malamig. Ano na po talaga siya, chronic. Yun. Tapos kahit nakapahinga siya, ayun, sinasakit pa rin. In transition between acute and chronic states, there is intermediate subacute states where excess side consume opposite sides. Ayan, nakita po natin pag subacute, tumataas yung yin, hyperactive yang. Na-consume kasi niya yung cold kaya tumataas siya. Halos natatalo niya. Hypersensitive yang. Yan. Example, high fever could cause dryness. Yan po yung sa natin sa drawing Pag ganyan po yung yang napakataas, may dryness pong sobrang mataas na init. Pakiramdam niya talagang nagda-dry po minsan po pati mga skin yan. Nagda-dry pati lalamunan nagda-dry. Or extreme humid weather can cause sluggish blood and fluid circulation. Yung stagnation naman, yung retention. So yan yung mga halos ayaw gumalaw. Ang bigat ng katawan. Kasi mabigat po kasi maraming yung nag-stagnate na hindi na nagsisirculate ng maayos yung blood, yung energy. The resulting state would look like this, similar to this. Ayan po, makita natin sa drawing. So, yung mga organs pong may problema, parang ganyan ang nangyayari sa energy. So, basta alam natin na pag mataas yung yang, so mga init ang nararamdaman. Pag mataas ang yin, mas mga lamig ang nararamdaman. Okay po. So, yun po. Baka po may tanong, may dagdag. Kung wala po, thank you po.
Thank you very much, Ma'am Mildred. We will now proceed to tongue diagnosis. Let's welcome Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector. Good afternoon po, classmates. Welcome po sa tongue diagnosis. Dry and white or yellow coatings part 2 na rin tayo. Okay? Our first patient this afternoon is a female, 29 years old. Tongue description, pale, swollen with slight teeth marks. Dry, white coating in the anterior third and center of the tongue. Greasy, thick yellow coating in the posterior third. Symptoms are nausea after eating cheese, runny or congested nose, cough with copious amounts of mucus, dizziness during menstruation, backache, and frequent urination at night. Western diagnoses are allergy to cow's milk and allergic rhinitis. Background to disease is excessive consumption of fruit with a minimum of 10 bananas per week. Chinese diagnosis, spleen-chi deficiency with accumulation of dampness, accumulation of cold phlegm, and accumulation of damp hits in the lower burner. Analysis, spleen-chi deficiency with accumulation of dampness. As we can see in the tongue picture, the tongue body color is pale with swollen body shape and has teeth marks. And the patient suffered from nausea after eating cheese. This indicates spleen-chi deficiency with accumulation of dampness. And this is caused by excessive consumption of fruit that the patient consumed a minimum of 10 bananas per week. Okay? Accumulation of cold phlegm. Para ma-internalize po natin, let us take a closer look on the tongue picture. Diba, as we can see it, the tongue coating is dry and white in the anterior third and center of the tongue, and the patient presented symptoms of runny or congested nose and cough with copious amounts of mucus. So it is very clear that there is accumulation of cold phlegm, right? Okay. Accumulation of damp hits in the lower burner. The tongue is greasy, thick yellow coating in the posterior third. Diba? Then the patient showed symptoms of dizziness during menstruation, backache, and frequent urination at night. So it is a clear indication of accumulation of damp heat in the lower burner. Okay, now let's go to the case history of the patient. For 6 months, 28-year-old Mrs. H followed a new diet. In the mornings, she ate only fruit, and her other meals consisted mainly of fresh salads and vegetables. As Mrs. H was hungry in between her main meals, she satisfied her appetite with bananas. She liked this new diet because she could not tolerate dairy products. However, while following the diet, she became increasingly tired and was more susceptible to cold. She had contracted a cold several months before, which left her with a cough. She expectorated copious amounts of white sputum. She also complained about a constantly runny nose. Her sleep was troubled by a frequent urge to urinate. Her urine was yellow and odorless. Conventional medical tests were negative. The tongue showed a dry white coating in the center and anterior third, and a thick yellow coating in the posterior third. Her pulse was confined and submerged. Analysis. This is a typical example of how raw foods can injure the spleen chi. Cold foods lessen the transformative and transportive strength of the spleen chi and yang, and contribute to the ensuing accumulation of dampness. In this case, the spleen chi deficiency was discernible in the swollen tongue body with teeth marks. The white dry coating and the firm pulse reflect an accumulation of cold dampness and the ensuing stagnation of qi in the middle burner. The dryness of the coating points to the long-standing accumulation of dampness and the resulting constraint in the movement of qi. The regular consumption of bananas further contributed to the spleen chi deficiency and to the buildup of dampness and phlegm. Okay? The symptoms also suggest that dampness is a causative factor for her complaints. The runny nose and the cough with copious phlegm reflect the impairment in the lung's downward moving action as a result of the retention of phlegm. Because dampness is heavy and tends to sink, it transforms into damp heat in the lower burner. It is responsible for the frequent urge to urinate in this case. The thick yellow coating at the root of the tongue reflects this pathology. Okay? Now let's go to our second patient, 38 years old. Tongue description, reddish, big rough tongue body. Red points at the tip, white dry coating turning yellow toward the center of the tongue. Symptoms are purulent sty, red conjunctiva, strong thirst, constipation, and inability to sleep through the night. Western diagnoses are chronic sinusitis and acute conjunctivitis. Background to disease, overwork, lack of sleep, and long-standing emotional problems. Chinese diagnoses are kidney deficiency with slight deficiency of fluids, heat in the heart, and accumulation of phlegm heat developing. Analysis. Kidney deficiency with slight deficiency of fluids. The tongue body color is reddish with big rough tongue body shape, and the patient presented symptoms of restlessness. Thus, very clear po na it indicates kidney deficiency with slight deficiency of fluids. Kaya po may inner restlessness because of heat resulted from overwork. Okay? Now, heat in the heart. Alam na po natin lahat na pag may red points ang tip of the tongue and patients showed inability to sleep through the night, it indicates heat in the heart. In this case, heat in the heart resulted from a background of problems. Okay? Then accumulation of phlegm heat developing. As we look at the tongue carefully, the coating is white and dry, turning yellow toward the center of the tongue. Patients showed symptoms of purulent stye. Excuse me. For those who are not familiar with stye, it is a bacterial infection involving one or more of the small glands near the base of the eyelashes. It is a red painful lump near the edge of the eyelid that may look like boil or pimple that are often filled with pus. Okay? Then another symptom is red conjunctiva or sclera, strong thirst, and constipation. All these attribute to accumulation of phlegm that develops into heat, resulted from lack of sleep. Okay, yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Do we have questions? Okay, kung walang questions, we will continue with another topic. Diagnosis by interrogation. So we will be continuing our discussion on sleep. We are still on insomnia. So when you diagnose sleep disturbances, you should first distinguish excess from deficiency or full from empty. No? And then second, you have to differentiate if it is a heart or a liver pattern. Full conditions, ang tinatawag nating excess, you have very restless sleep with a feeling of heat, agitation, and excessive dreaming. Yung empty or deficiency conditions, not being able to fall or stay asleep without any of the symptoms above. Pag liver pattern naman that causes insomnia, there is excessive dreaming. Kapag heart pattern, there is severe restlessness. Okay, so you should know the difference. The heart and the liver are not the only organs that cause insomnia. Pwede rin yung stomach, spleen, kidneys, and gallbladder. For example, if you have deficiency of spleen blood, so this will accompany heart blood deficiency. Okay? And kidney yin, katulad ng liver yin, kailangan din niya i-anchor ang mind, pati yung ethereal soul at night. Yeah, this is the reason why pag medyo tumanda ka na, or tumanda ka dahil sa dami ng mga pressure sa buhay natin, you cannot anchor the mind and the ethereal soul at night. Therefore, if you have kidney yin deficiency, with or without empty heat, this can cause insomnia. Okay? Deficiency of the gallbladder and heart. These are people who will wake up early in the morning and they cannot sleep again. Okay, sino ba nakaka-relate dito? Alauna gising ka na, hindi ka na makatulog ulit.
Aray ko po, aray.
A less common cause ng insomnia is residual heat in the diaphragm, which is secondary to invasion of wind heat. So this is acute type of insomnia with recent onset.
Problema sa ano.
So now let's go to etiology and pathology of insomnia. So do you like this, what do you call this, schematic diagram or flow chart, no? O tingnan mo yung mga nagwo-worry dyan. Affected po yung heart and spleen. No? Affected yung heart pati spleen. So magkakaroon ka ng blood deficiency. Okay? Yung overwork, this will affect the heart and kidneys. So you'll have yin deficiency. Timid at saka gallbladder, no? heart and gallbladder. So you'll have Qi deficiency. Yung mga medyo matakutin, masyadong parang walang kalatoy-latoy. Okay, ito yung mga medyo ayaw mag-take ng risks, masyadong mahina. Okay, so magkakaroon ka rin ng insomnia. Childbirth, anak na anak, syempre grabe na pag traumatic yung delivery mo. This will affect heart and liver, so you'll have blood deficiency, so you will have insomnia. And also worry, kung heart lang ang affected, kung super heart lang yung affected, they will have heart fire. Pag anger naman, heart and liver, kakaroon ka ng liver fire. Pag diet, stomach and heart, you'll have phlegm heat. Okay, so yung mga mahilig sa maanghang. Anything that is not stomach friendly. And then wind heat. This was the last topic we discussed earlier. When you check the diaphragm, you'll have residual heat. So the main patterns appearing in insomnia are the following. Heart blood deficiency. If you ask the patient, hindi siya matagal siya makatulog. And then, if you want to know if it's really heart blood deficiency, there should be palpitations. No? And then when you look at the tongue, since this is deficiency, it is pale, then the pulse is choppy or fine. Now, for the deficiency of blood naman of the spleen and heart, difficulty in falling asleep plus palpitations, tiredness, tongue is pale, choppy pulse. Pag heart deficiency, insomnia with difficulty in falling asleep. So ibig sabihin, you get to wake up from time to time. Then you have palpitations, tongue without coating, floating empty pulse. Liver blood deficiency, insomnia with difficulty in falling asleep, dreaming, that's very liver blood deficiency, dizziness, blurred vision, pale tongue, choppy fine pulse. Liver yin deficiency, insomnia with difficulty in falling asleep. Dreaming, dizziness, blurred vision. Kasi pag sinabi mong, dry eyes, tongue without coating, floating empty pulse. Now, heart and kidney yin deficiency, insomnia with difficulty in falling asleep, dizziness, tinnitus, tongue without coating, floating empty pulse. Heart and kidney yin deficiency with heart empty heat. Okay, you wake up frequently during the night, meron ka anxiety, night sweating, dizziness, tinnitus. Remember, this is yin deficiency, walang coating. Pag may empty heat, red. Like an empty rapid pulse. Okay, gallbladder and heart deficiency. Madali kang magising sa gabi and you're easily startled, just like my patient earlier. So, malalaman mo talaga, pag pinrest mo sa gallbladder 40, render. Nagulat siya, di ba? Tinatanong mo na, madali ka bang magulat? Ay, oo, di ba? Difficulty in going back to sleep, have to wake up early in the morning, depression, timidity, hypochondrial discomfort, palpitation. So doon ko na nalaman na naging depressed pala siya for a while staying in Germany for 15 years. Liver fire, insomnia, excessive dreaming, restless sleep, propensity to outbursts of anger. So think of the apoy, headaches, red tongue with redder sides, dry yellow coating, wiry rapid pulse. Phlegm fire, harassing the heart. Okay? So imagine mo yung itsura ng tongue, super laki. Restless sleep, insomnia, dream disturbed sleep, sputum in the throat, red tongue with redder tip and sticky yellow coating, slippery, overflowing, rapid pulse. Heart fire. Okay. Restless sleep, dream disturbed sleep, palpitations, agitation. Since heart fire ito, yung tongue is red with redder tip and yellow coating, overflowing, rapid pulse. Residual heat in the diaphragm. So this is the result of a wind heat invasion. Restless sleep refers to sleep propped up. So lalo na kung pag nagka-COVID ka na, okay, inability to fall asleep, mental restlessness, feeling of oppression of the diaphragm. And when you look at the tongue, you'll see red points, front or around the center of the tongue, slightly rapid pulse. Okay. So treatment, This is important. I hope you take a picture of this one. So, yung alam niyo madaming pasyente may insomnia. If you want to have
Opo.
super daming fans, alam mo, you have to be different than the rest. Wag yung puro yintang lang pati ko ano-ano dyan. You have to know, you have to look at the tongue, diba? So like this one, blood or yin deficiency of the heart, spleen, or so you would be looking at the tongue that is pale, walang coating, right? And you used heart 7, Ren 15, do 24, spleen 6. Indeficiency with empty heat, heart 7, Ren 15, do 24, paulit-ulit, no? Spleen 6, kung kaibahan nito yung Ren 4. Ren 4, kidney 3, very good for the yin deficiency. Full heat, so super daming heat, phlegm fire. Heart 8, stomach 44. Ella 11, stomach 40. Actually, si Sir Michael memorized na itong mga 5 shoe points. So, diba? Empty heat, heart 6, kidney 3, heart 7, Ren 4, spleen 6, Ren 15. Retention of food. This is the reason why iyak ng iyak yung anak mo paggabi. No? You might want to look at the tongue. So you do Ren 12, Ren 10, stomach 44, stomach 40, spleen 4. Gallbladder and heart deficiency, ito yung mga ano, wait lang, store mo. Ay. Gallbladder and heart deficiency, gallbladder 40. Yeah, o diba? So yun, yung mga matatakutin, yung madaling magulat, at saka nagigising very early morning, hindi na makatulog ulit. If you press gallbladder 40, masakit siya. So, this is a summary. If you have insomnia, difficulty in falling asleep, blood or yin deficiency, heart, spleen, liver. Insomnia with difficulty in staying asleep, gising ka ng gising. Indeficiency with empty heat, heart, liver, kidneys. Restless sleep with excessive dreaming, full heat, heart, liver, stomach, phlegm fire, stomach, heart. Waking up at night with a dry mouth, dreaming, night sweating, empty heat, so heart, liver, kidneys. Restless sleep with abdominal fullness, retention of food. Waking up early in the morning, gallbladder and heart deficiency. I hope that helped. Thank you very much. Panoorin niyo po sa YouTube to. And by the way, congratulations sa lahat. We're already having a lot of viewers from 14 countries, no? So and we've been receiving good comments about this acupuncture webinar. Okay? So I'm sure hindi lang sila ang nag-enjoy, sana pati Pinoy din. But if you are a practitioner who doesn't care about the patient, you don't have to attend. Kailangan tayo mag-level up, no? Bawal po ang mediocre, and the patient will actually feel na parang wala ka ring alam. And it's difficult to pretend, sa totoo lang. And especially if you meet somebody like one of the Zoom attendees here. In fact, he was the reason why I had to really prop up the quality of our 8 to 9. Dahil grabe, no? Yung natutunan natin ng 18 months, natutunan niya in 2 months. And hindi ka pwedeng magsabi ng hindi tama because binabasa niyo po yung pattern. In fact, this afternoon he was there and he observed me with my 4 patients. But anyway, so yun, I hope everybody will level up. And thank you very much for all your support. And sana po we will attract practitioners like us. So if you're not one of us, then you must not be very good. Sorry. Okay, so let's now go to the next one. Let's go to pulse diagnosis. Another modality that we should all be very good at. This is something that you cannot teach in the clinic. This is something that you have to learn by yourself. Let's welcome Sir Dino Pinero. Welcome back for pulse diagnosis. Good afternoon, sir.
Good afternoon, Doc. Good afternoon, classmates. Ang topic natin is big pulse. Big pulse is large, broad, overflowing from its boundary and full. It is very similar to the overflowing pulse, but it has more shape and is not necessarily rapid. Sa significance naman, the big pulse generally indicates heat, and its clinical significance is similar to that of the overflowing pulse. When we feel a big pulse, it is important to check this against the tongue and the inside of the over eyelid. Tama ba? In true conditions of heat, ang tongue niya is red and the inside of the lower eyelid will also be red. So, i-check natin yung tongue na red siya and the lower eyelid. Pwede natin ma-check na red din yun. We need to differentiate the big pulse with strength from the big pulse without strength. So, dalawa po. Yung big with strength, the strength indicates internal heat, which may occur in the heart, liver, lungs, and stomach. In acute febrile disease, it indicates heat in the stomach at the chi level. Common pattern presenting with a big pulse with strength are acute febrile disease at the chi level, liver fire, heart fire, heat in the intestine, and phlegm fire. And this appears in conditions such as acute chest infection, intestinal infection, or heart disease. Sa big naman without strength, this indicates yin deficiency with empty heat or severe depletion of blood. Sabi sa simple question, the big pulse indicates deficiency of yin and excess of yang with empty heat. Common pattern presenting with a big pulse without strength are severe blood deficiency, yin deficiency with empty heat, blood deficiency with liver yang rising. This pulse frequently appears in menstrual disorders and diabetes. So dito po natin i-check itong big pulse without strength. Sa big pulse summary clinical manifestation, yung full heat, big with strength. Pag yin deficiency with empty heat, big siya without strength. Nawawala po siya pag nag-pressure. Sa combinations, big deep indicates internal heat dahil malalim. Big wiry naman indicates liver fire. Big saggy denotes empty heat with dampness. Big overflowing naman indicates stomach heat. Big full indicates severe chi stagnation. Sa differentiation of similar pulses, pag overflowing, the big pulse is very similar to overflowing pulse insofar as they are both superficial, large, and going beyond the pulse boundary. The big pulse, however, is rounder than the overflowing pulse. It has more shape and it is not necessarily rapid. So, mas ramdam ang shape ng big pulse. Sa full naman, the full pulse is simply indicates that the pulse is full and relatively hard, whereas the big pulse is larger than its boundary, more superficial, and relatively softer. Mas malambot po yung big pulse kumpara sa full. Sa long naman, the long pulse extends beyond the pulse position lengthwise and is not superficial. The big pulse extends beyond the pulse position in all direction and is superficial. So, yan po yung sa big pulse. Sa clinical significance in its position, this is the same as for the overflowing pulse. Okay po, thank you for listening.
Thank you very much, Sir Dino. Do we have any questions? Okay, wala pa rin. We will go now to differential diagnosis and let's welcome Ma'am Needs You. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc?
Clear, very clear.
Thank you, Doc. So, the, the topic for today in our TCM Foundations number 165 is kidney deficiency, water overflowing. Okay? This pattern is a severe case of kidney deficiency and necessarily a very chronic condition. This is both a deficiency and excess pattern. The excess part being the accumulation of fluids. Okay? It occurs when kidney fails to transform body fluids since the kidney is the ruler of the water. Okay? It accumulates under the skin to form into edema. It also often causes water retention in other organs, particularly the heart and the lungs. Okay? If it affects the heart, the patient will also have symptoms of palpitations and cold hands. So, yun. If it affects the lungs, symptoms will include coughing with a thin, watery, frothy sputum, which is indicative of the presence of phlegm fluids formation. Okay? The declining of kidney yang causes a dysfunction of the urinary bladder Qi activity, manifesting as scanty urination. General edema is due to the water and fluid overflowing into the skin and muscles. So, retention of water and fluid in the abdominal cavity gives rise to local distension. So, namamaga na. Excess water and fluid converts into phlegm, manifesting as cough and asthma with sputum gargling in the throat. If water and fluid overflow upward, they attack the heart and lung, causing symptoms of palpitation and shortness of breath. Yang deficiency fails to warm and nourish the extremities, so it causes chilliness, nagiginaw, and cold extremities. So, ang etiology ng pattern na to is chronic, long-standing retention of dampness from spleen yang deficiency. Transmission from heart yang deficiency from poor constitution and or emotional problems. That is water overflowing to the heart. Transmission from lung Qi deficiency from exterior cold retained in lungs. That is water overflowing to the lungs. Okay? Underlying or accompanying pathology, kidney yang deficiency, heart yang deficiency, lung Qi deficiency. Okay? So, causes excessive consumption of cold and raw food. So, yan. Sobrang daming kong kumain ng malalamig at hilaw na pagkain. It weakens the kidney yang. Pag nag-deplete yung kidney substances such as alcohol, coffee, or sugar, it can also be other factor. Okay? Excessive physical work. Yung excessive exercise din, especially lifting things. It weakens the kidney yang. Excessive sexual activity, especially in men, particularly yung masturbation, it weakens the kidney yang. Beware. So, poor hereditary constitution din, because they're the source of essence. The kidneys are particularly affected by hereditary weakness. Okay? Chronic illnesses, yun, it leads to spleen yang deficiency pagka matagal nang nangyari, and it can lead to kidney yang deficiency. Okay. Signs and symptoms, edema, especially of the legs and or ankles, cold feelings in the legs, at saka sa back, fullness, distension of abdomen, sore lower back, parang namamaga, feeling cold, scanty, clear urine. Okay? Water overflowing to the heart, plus palpitations, breathlessness, cold hands. Okay? Kapag yung may tubig nag-overflow sa lungs naman, plus thin, watery, frothy sputum, kanina binanggit na natin, may ubo, may asthma, hindi makahinga, lalo na kapag may exertion or movement. Okay? Ang pulse, if you see the pulse, palpitate the pulse? Is this deep, forceless, or slow? Okay? Yung tongue, tingnan mo yung tongue, pale, swollen, wet with white coating. Okay? Paano natin siya i-treat? Principle of treatment is to warm and supplement the kidney, spleen, heart yang, boost the lung qi, and promote urination. Acupuncture treatments na gagamitin natin. Points. Bladder 23, it supplements the kidney. Bladder 22, stimulates transformation of fluids. REN 9, regulates the water passages. Spleen 9, yan, maganda sa dampness from lower burner. It resolves dampness from lower burner. DU4 or the Mingmen supplements kidney yang. Bladder 20 supplements spleen, resolves dampness. Stomach 28 promotes transformation of fluids. Spleen 6 supplements spleen, resolves damp. Okay? Ang gagamiting technique ay tonifying or with supplementation and use moxa. Okay? Thank you very much. I hope you learn.
Thank you very much, Ma'am Neats.
Thank you po, Doc.
Any questions po? Okay, if there are no questions, we will go to acupuncture patterns and practice, and let's call on Sir Dino once again. Good evening, Sir Dino.
Good evening, Doc. Good evening, classmates. Topic natin, strangury sa clinical applications. Okay. In urgent condition, we need to treat the branch. Sa moderate condition, we need to treat the root. When treating strangury with complex patterns, we need to evaluate if it is an urgent case or not. In the case where the pain is very severe with danger to the patient's life, we will need to treat the branch by expelling the pathogenic factors to stop the pain. So yung branch muna para mag-igi yung pakiramdam, ma-stop yung pain. More moderate cases or with recurring cases of strangury with mild symptoms, we need to treat the root of the pattern and tonify deficiency to prevent the syndrome from manifesting again. Yun sa moderate and chronic. Also, it is important to remember that after clearing damp heat in an acute case, it is important to reinforce healthy qi. Number 2, avoid promoting sweating and supplementing. It is recorded in ancient medical texts that treatment of promoting sweating and supplementing should be avoided in the syndrome of strangury. So, wag natin ipopromote yung sweating. For example, sa essential from Golden Cabinet, wasting thirst, inhibited urine, and strangury chapter. So sabi doon, do not apply sweating for strangury. Teaching of Su Dan Shi Strangury states that last treatment approach to be used is qi reinforcing, as by supplementing the qi, it will cause more distending and heat. So yun po, magdi-distend and magkakaroon pa ng heat. However, it is not necessarily true in every clinical case naman. Strangury often comes with fever, but it is not due to attack of exogenous pathogens. It is the result of damp heat, steaming, and the binding of the pathogen and healthy qi. In these cases, to promote sweating is certainly inappropriate. Strangury usually lies in heat in the bladder with depletion of body fluid. Hence, applying sweat-promoting medicinals would further deplete the body fluids. So, ito po yung nangyayari pag nag-promote tayo ng sweating, this would further deplete the body fluid and aggravate the symptoms. However, if the strangury syndrome is induced by external contraction of pathogen in the exterior layer with aversion to cold or wind, and heat sensation when we can promote the sweat and release exterior to remove the pathogen from the exterior layer. Pag exterior pa, pwede natin gawin yung sweating. So apply wait. Sana yun. Apply supplementing or tonifying approach in strangury. Excessive heat or excessive dampness would only increase the pressure and aggravate the symptoms. It is best to remove the pathogen by clearing heat and draining dampness, and only when the pathogens are resolved can we supplement the kidney chi and essence and fortify the spleen chi. So sa comprehension question, number 1, how can we differentiate blood in the urine and blood strangury? Ano ba yun? Blood urine and blood strangury both have the main symptom of having blood in the urine manifesting as red-colored urine of light or darker color. The key characteristic to differentiate them is the presence or absence of pain during urination. Bloody urine often has no manifestation of pain, though mild distending pain may be experienced in bloody urine, while the level of pain in blood strangury is much more severe. So mas madugo po sa blood strangury. Number 2 question, how do we differentiate the type of strangury and treatment principles? There are 3 steps to treat strangury on the basis of pattern differentiation. Number 1, differentiate the categories of strangury. There are 6 types of strangury which have different pathological mechanism and manifesting symptoms. It is important to distinguish which type of strangury is presenting, to be able to treat it accordingly. Its strangury has an acute onset with symptoms of fever, burning, painful frequently, and scanty urination. Stony strangury has the presence of small or sand-like pebbles in the urine causing severe pain during urination or causing sudden interruption of urine flow and colic pain in the waist and abdomen due to the blockage in the ureter and kidney. Chi strangury naman manifest as obvious abdominal distension, difficult painful urination, and dribbling after urination. Sa blood strangury manifest as having traces of blood or blood clots in the urine accompanied by severe pain. Chilus strangury manifest as turbid and cloudy urine or slippery and greasy urine. The features of strangury due to overstrain is chronic or recurring strangury with dribbling after urination, which relapses due to overstrain. Number 2, pag-differentiate excess and deficient pattern. Once the appropriate type of strangury is identified, we must recognize if it is an excess or deficiency pattern on basis of its manifestation. Sabi dito, generally speaking, excess pattern have an acute onset with severe symptom and usually caused by damp heat in the bladder, stone accumulation, and chi stagnation. Pag deficient pattern naman often have a chronic course of disease with recurring symptoms of mild pain during urination and are usually due to kidney and spleen chi deficiency. So yan po, deficient pattern. Chi strangury, blood strangury, and chilus strangury all have pattern of deficiency, excess, and combination of excess and deficiency. So dito sa may halo-halo na. Different types of strangury can coexist and transform into each other. So we should differentiate the urgency of symptoms and pattern differentiation. The general guideline for determining the root or the branch needs to be the priority in treatment principle of Strangery. When the symptoms of pain is severe and the patient's life is threatened, as in stone Strangery, the branch is more important to treat immediately. So, unahin natin yung branch. When the symptoms are acute and pathogenic factors are more severe, with a strong healthy chi or a strong root, the treatment will also be removing the pathogenic factor first. And once they have resolved, the treatment will change to nourish the healthy chi. In cases where there are no pathogenic factors and symptoms are mild due to deficiency, the treatment will automatically fortify the root to reinstate the function of the kidney and spleen. So, thank you for listening. Ganda po.
Thank you very much, Sir Dino. Do we have any questions? Okay. Tuloy na po tayo sa signs and symptoms. Let's call on Sir Alvin Palabay, straight from Camarines Norte. Good evening, Sir Alvin.
Alright, so we are on our 48 signs and symptoms. We're going to talk about bad smell, loss of sense of smell. Okay, so let's talk about bad smell. Bad smell refers to the subjective sensation of a bad smell in the nose when one is. Okay, it's the pattern present in the lung. Bad smell in the nose, scientific lung. No, yellow nasal discharge, facial pain, swollen pain, partner of the skin, sticky yellow or green mucus, shortness of breath, breathing, a feeling of pressure of the chest, a feeling of feet, thirst, insomnia, agitation, red and swollen tongue with a sticky yellow coating, unknown palsy, facial pain, dull, frontal headache, feeling of heaviness of the head, exactly coldness, pain, meron siyang tiredness, down, slight shortness of breath, slight cough, voice, continuous negative breath, dislike of speaking, bright white complexion, defensive to catching cold, tiredness, dislike of cold, pale ang tongue with a sticky yellow coating, ang pulse niya is drug. Okay, so pag pattern naman, diagnose natin lang, dull, flower, and fever. Of course, meron ng yellow discharge, facial pain, meron ng illness, or pain of the hypochondria, or gastritis, poor appetite, nausea, feeling of heaviness of the body, yellow vaginal discharge, vaginal sleep cycle, bleeding, or burning, or urination. Dark urine, yellow complexion, eyes, then vomiting, hanging down, the new weather style, unilateral or bilateral, 2 years old. So, ang pulse na wiring slipper wrap. Right? So, ang explain deficiency naman is that with slight lang yung kanyang start, depress the muscle, dull frontal surface, poor ang appetite na, slight abdominal distension after eating, tiredness, lack of sleep, pale or sour complexion, weakness of the limbs, loose stools, abdominal fullness, feeling of heaviness, damp, acidity, poor digestion, thirst without desire to drink, undigested feeling of food, nausea, excessive vaginal discharge, pale ang tongue with difficulty reporting and stomach. Okay, so let's go to the loss of smell. Sense of smell. Okay, poor condition, damp within the stomach and skin. Loss of sense of smell, yellowness of start, facial pain, headache, a feeling of heaviness, especially of the head, a feeling of fullness and feeling of gasping and lower abdomen, poor appetite, thirst without desire to drink, feeling of dull yellow complexion, sticky taste, ang tongue niya is red, sticky yellow coating, the pulse is super rapid. Okay, mga recommended points, rank 12, rank 9, extreme 9, rank 5, color 22, LI 11, and okay. Okay, kapag ang pattern naman is foundation of wind sleep, okay, merong sudden loss of sense of smell, aversion to cold, fever, sore throat, headache, body ache, light sweating, tongue with left side and so on, floating rapid pulse. So, ang mga points niya, LI4, LI5, LI12, lungs 7. Okay. Kapag ang pattern naman is invasion of lymph, other patterns, kaya deficiency of fluid and blood. So, pag deficiency of fluid and blood, gradual loss of smell, sense of smell, pale ang nose, tiredness, poor appetite, loose stool, palpitation, dizziness, so pale ang tongue, weak or chubby. Okay? So, kapag damping in the gallbladder, loss of sense of smell, balak-balak din ng nose, yellowness of the discharge, may headache, mitochondrial pain, fullness and distension, nausea, vomiting, ability to digest fat, yellow complexion and eyes, may dizziness, tinnitus, irritability, feeling of heaviness, unilateral or bilateral, thick, sticky yellow coating, little rapid ang pulse. Alright, so cold, dampness in the stomach and skin, loss of sense of smell, whiteness and discharge, facial pain, headache, a feeling of heaviness of the head, abdominal pain, loose stool, tongue with sticky white coating, little. Right, pag may blood test na naman ka lang, gradual ang loss of sense of smell, parang deficiency of Q and blood test. Black nose, pain on the nose, headache, chest pain, may cough, may pulse. Malalaman lang natin ang symptoms kapag purple ang tongue. Nag-wire din. Right, so thank you so much. That's all for today. Any questions po?
Thank you very much, Sir Alvin.
May kasalan yata kala Sir Alvin, Doc.
Mukhang mahilig sila kumanta, no? Okay, anyway.
Oo nga po, yun ang malakas na narinig.
Oo nga po.
Grabe. Mukhang...
Pasensya na po.
okay, so maraming
Malayo
salamat.
na nga ako. Medyo malayo na pero narinig pa rin pala.
Mukhang mahilig
Anyway,
sila dyan sa
so much.
party. Mabuti pa sila. Okay. So maraming salamat po, Sir Alvin. Thank you very
Thank you
much.
so much po.
So we will now proceed to the last but not the least. Let's now listen straight from, ewan ko kung may party rin po. From Urdaneta, Pangasinan. Let's listen to Sir Aldrin Tukay. Good evening, Sir Aldrin.
Hello po, Doc Hector. Magandang hapon sa lahat. Hindi po party ang maingay dito ko sa akin. Along National Highway yung bahay, kaya ang ingay ng mga sasakyan. Sige, so let's proceed sa ating anxiety topic. Share screen lang po ako. Okay, so yon mga identification of pattern pa rin tayo at saka treatment. Okay? So yung mga patterns natin, number 1 is heart-yang deficiency. So clinical manifestation po niyan, given na heart nga yung involved, so may palpitation, may anxiety, pale face, feeling cold, cold hands, slight breathlessness, discomfort in the chest. So, given na yang ang deficient, mapapansin nyo, magkakaroon ng mga cold signs and symptoms. Feeling cold, cold hands, ganun po. Okay? Tapos, yun po, yung pale face, syempre, yang deficiency po kasi. Yung tongue is pale, then wet. Wet kasi kulang nga sa yang, di ba? So, hindi siya kulang sa yang, kaya wet ang itsura nung tongue natin. Pulse is deep and weak then. So mental emotional profile. So yung person na is anxious but also depressed and listless. Everything is an effort and they speak very difficult. Okay, so yun parang ang hirap niya, 'di ba? Nahihirapan. Ganyan lahat is kailangan ng effort. Ganun kasi yun nga po, parang alam niyo po yung pakiramdam ng nahahapo, gano'n, lalo na kapag heart ang involved, 'di ba? Parang konting kilos mo napapagod ka agad. Gano'n po 'yon. So dahil deficiency po ito na pattern, definitely we need to tonify the heart yang and then calm the mind. Okay, so points natin, heart 5, bladder 15, do 14, ren 6, at saka stomach 36. So, reinforcing method kasi deficiency pattern. And then, syempre dahil yang ang deficient, makakatulong na i-supplement yung yang. So, moxa is applicable. So, yung mga points natin, yung blood, heart 5, bladder 15, do 14, tonify, heart yang, and calm the mind, then ren 6 at saka stomach 36 with moxa, tonify yang in general. Okay, so yun po yung mga points natin. Next pattern po is lung and heart chi deficiency. So deficiency pattern ulit po ito. So given na may heart chi deficiency, may involved pa rin na palpitation, anxiety, timidity, easily frightened, sadness, tendency to crying, weak voice. Okay, so yon yung sadness, makikita natin dito sa mga signs and symptoms due to the lung deficiency, right? Weak voice, slight breathlessness, propensity to catching cold. So, yon sa lungs po yung mga yan. So, tongue is pale also. Pulse is weak also on both front position. Okay? Kasi both front position kasi is position ng lung at saka ng heart natin. So, mental emotional profile, this person is anxious but also sad. They are often affected by grief following a loss. So lalo na yung mga nagdadalamhati, talagang yung lung nila talaga yung compromised, okay? Kasi yun po yung kanyang emotion, yung grief. Okay, lalo na kapag ganitong lung deficiency, meron talaga yung mga yung talagang ang tagal nilang nagdadalamhati, naggi-grief, okay? So they will tend to be pale and speak with a weak voice. So the anxiety is experienced in the chest. Okay, so mabigat yung chest. Okay, so tonify natin si heart at saka lung chi and then calm the mind. So points natin, andito pa rin si heart 5, then heart 7, bladder 15, backshoot po yan ng heart, red 14, lung 9, lung 7, bladder 13, baliktad po yata ako. Bladder 13 is back to point naman po ng lung po ito. Hindi po ako napagbaliktad po yata. Then do 12, ren 12, ren 6 at saka stomach 36. So yung mga points natin, reinforcing method yung ating gagamitin. So yung mga points combination natin, heart 5, heart 7, bladder 15, ren 14, tonify the heart and calm the mind, lung 9, lung 7, bladder 13, and do 12, tonify lung chi. So tama po tayo, bladder 13 is back point ng lung, then bladder 15, back point po ng heart. Okay, so ren 12, ren 6, stomach 36, tonify chi in general. Next pattern po natin ay clinical manifestation. Next is lung and heart chi stagnation naman. Kanina deficiency, ngayon stagnation. So may palpitation pa rin, anxiety, a feeling of distension or oppression of the chest, depression, a slight feeling of a lump in a throat, slight shortness of breath, sighing, sadness, chest and upper epigastric distension, slightly purple lips, pale complexion. Okay, so yun, makakakita tayo ng mga signs ng stagnation, di ba? Kasi syempre, chi, stagnant, hindi yan gumagalaw. So, yun po pwedeng mag-retain yan, di ba? Magkaroon ka ng lump sa throat, ganoon. So, yun po yun. Tongue is slightly pale, purple. Purple kasi stagnation on the side in the chest area. And then pulse is empty but very slightly overflowing on both front position. Okay, so mental emotional profile, anxious but also worried and sad. Okay, sad is emotion yan ng anong ngalan nito? Ng heart. Okay, emotion na ng heart kasi more on joy kasi ang heart kapag counterpart ng heart kapag compromised yon sadness. Okay, so kasama na rin po yung lungs diyan lalo na kapag merong grief. Worried, more on worry kasi more on spleen pero associated din po siya sa heart. So they will tend to be pale and speak with a weak voice. So the anxiety is experienced in the chest. So treatment principle, i-move natin si chi kasi stagnant nga po. And then relax the chest and calm the mind. Wait lang po. Maingay sa background. Mute ko lang po saglit. So, sorry po. Okay, so mental, emotional Ay, okay, sige. Tapos nandito sa next is lung and heart chi stagnation yung mga points. Heart 5 andito pa rin, heart 7 andito pa rin, pericardium 6 na idagdag, ren 15, ren 17, nawala po yung mga baksyo point kanina. Okay, na idagdag yung mga front point naman. Then lung 7, stomach 40. Okay? So even method yung gagamitin natin. So yung explanation ng mga point, heart 5, heart 7, pericardium 6, move heart chi and calm the mind, ren 15 at saka 17, relax the chest and calm the mind, lung 7, so definitely move chi of the lung, then stomach 40 in combination sa lung 7 at saka pericardium 6, relaxes the chest and calms the mind. So, yun lamang po yung topic natin. Thank you po.
Can I ask question?
Yes po, yes po.
Clarification lang, clarification ba to? Yung tayin, di parang part din siya ng calm of the mind? Correct me if I'm wrong.
Tayin.
Tayin.
Ang tayin. Anong tayin? Yung taying po ay taying point, yintang, taying, yung sa tayang? Ang tayang yung sa may temple po yata natin yon.
Opo. In the eye? Yung ba yun?
Medyo nalilito ako. Napagbabaliktad ko yung dalawa na to eh.
Ako rin eh. Kaya pumasok lang naman po sa isip ko kasi parang nagagamit ko siya as calming the mind.
Huwag kayong malito, pinapakinggan tayo ng 13 countries sa Intang, Tayang.
Yeah, sorry.
Google it. Yung these are actually extra points, di ba?
Extra point po sila, yes po.
Huwag yung i-confusion sa Taiyang channel sa Taiyin channel. Taiyang kasi, this is the supreme, basta brightness. Taiyang. Yung nasa temples, di ba?
Yes, opo. Yes,
a little lateral to gallbladder 1. Tapos may feel ka na parang we usually do this sa mga young dominant symptoms, nawawala yung Then yung intang, this actually represents the area of your pineal gland, no? And ito yung parang third eye. If your patient is very nervous or anxious about the procedure, pag inuna niyo po ito, talagang gustong-gusto niya, nare-relax siya and mag-open yung kanyang sa ibang needles. Okay?
Okay po.
Please don't confuse yourselves with this. Intang and Tayang. Maraming salamat, Sir Aldrin. Mukhang na-confuse.
Sorry.
Okay.
Opo, so okay lang po. Ginagamit talaga natin yon. So as discussed natin nung mga nakaraan, meron talaga in treating anxiety, meron talaga yung mga head point at saka yung mga distal point. So yun, mga special point sa head, ginagamit din talaga natin to calm the mind. Opo. So usually, mas more on practice natin, ang ginagamit natin is do 20. Okay, pero dito sa mga previous slides natin, mas ang sinasabi ng author is do 19. Yung point. Opo. Sige po, thank you po.
Thank you po.
Thank you very much sa question. Meron pa pong magtatanong? Okay, salamat. We have no Zoom tomorrow, pero mamaya meron pa rin. We will invite you to Balance Method by Dr. Gavino, the fifth and last day. Thank you very much, everyone. Let's take a short break. See you later at 8 o'clock. Good evening, everyone.
Thank you.
Thank you, Doc.
Trainers. Thank you po.
Thank you, Doc.
Thank you.
Thank you po. Bye-bye po.